Good afternoon from Dakar, and good morning to colleagues who are waking up in other parts of the world, and good evening for those who are ending their days. And we are very, very pleased to welcome you to this session on preparedness. And the question is really what we have learned from preparedness with regard to this pandemic, in the middle of which we still are. Is there a recipe for success? To answer this question or to debate it, I have the privilege to be joined by wonderful colleagues and friends, whose pictures and title you have seen in the introduction. But let me just repeat: Dr. Maha El Rabat, the Executive Director of Middle East and North Africa Health Policy Forum, joining us from Egypt. A dear friend, Dr. Patrick Osewe, the Chief Health Sector Group of the Asian Development Bank. A colleague and friend, Ms. Amanda McLennan, the Senior Vice President, Prevent Epidemics, Resolve to Save Lives from New York City. And Her Royal Highness Tunku Puteri Intansafinas, the Chairwoman of the Malaysian Red Crescent Society. It will be a rich debate, I'm sure, and it will be articulated around 4 main axes. We will be looking at the human dimension of preparedness. We will also try to address, the financing challenge that we are facing and the need for reform, the agile systems and stronger coordination that are required, and how do we measure all of that? Is there progress? And then how do we know it? We invite you to participate and then ask questions. So, because it's going to be a very interesting debate for sure. For those who would like to see the rerun session, we invite you to please visit pmac2021.com and click on the session of your interest. For those who would like to send questions to speakers during the session, please use the Q&A function and type your question. The moderator will select questions in the Q&A box and we will forward it to the panelists. So we make sure we address your concern as well as your comments and your question. As I said at the beginning, we are in the middle of a pandemic, which is a shock. We will always be faced with shocks and hazards, climate shocks, health shocks, more and more. These shocks do not have to become catastrophic situations. These shocks do not have to become crises. The fact that they become crisis or not will depend on many factors. Are we prepared or not? Do we have early alert and early warning systems or not? Do we have early response mechanisms or not? When we respond, are we accompanying communities alongside that response and invest in their capacities so that they have the ability to withstand the next shocks next time around? Or are we getting ourselves into what we call a cycle of panic and neglect, meaning that we all come in with our big artillery to try to respond to a crisis, and when we believe that it subsides, we go back to what we believe to be business, as usual. And again, and again, and again, we come back and try to react. Those reactions do not mean any longer-term response. There are many, many elements, there that we will be having to unpack and then discuss, that will be making a response, sustainable and, preparedness, to be part of the continuum of the response all along, from being prepared to building the resilience, down the line. The GPMB, which is the Global Preparedness Monitoring Board, which I have the privilege to co-chair with Dr. Brundtland, have already issued 2 reports. The title of those reports are quite sobering. The first one, we call it A World in Crisis, A World at Risk. The second one, we call it The World in Disorder. that is sobering in many ways, because to predict a catastrophic situation and see it happening is not a good feeling. If we are so smart to see things coming our way, why can't we be smart enough to prevent it from happening? And that's the key question of preparedness. If now we are hit, so our weaknesses are revealed at all fronts. Do we have the systems to respond? Do we have the networks of solidarities? Do we have the coordination mechanisms? Our multilateral system is being tested. Will it pass the test? Do we have the measurements that are required to show that we are making progress or not? And out of that, we feed it again into the continuum of preparedness and response. So those are some of the challenges that we are facing. And our very distinguished members of the panels will be having a conversation really around that. So let me then start with the human dimension of preparedness. So what we've seen also as one of the very critical elements in preparedness from a human dimension point of view is the importance of leadership. Leadership that cares, leadership that makes promises and deliver on them or not, leadership that is connected or disconnected with communities, leadership that is accountable or not, leadership that is trusted or not. And we're seeing that that it will be making a difference. So I would like to invite Her Royal Highness Tunku Puteri Intan Safinas to address us in trying to respond to the question related to leadership, namely, how can leadership be responsive to communities and promote trust and equity so that they can drive the whole community and beyond a whole country in a positive mood of response and a positive mood of preparedness? The Royal Highness, you have the floor, please.
Thank you, Mr. Asi, for the privilege of being here. Thank you to the organizers. Pandemics, like we know, like disasters, do not discriminate. But we have seen from the start of COVID-19 that certain groups are more vulnerable than others. Two of the groups that are at most at risk, which are very relevant to Malaysia and also to Southeast Asia, are the migrant workers and refugees. I'd like to make some points here about the need to take special effort to include these groups in our preparedness and response efforts. And I think this is one of the examples of leadership that needs to be shown. We know that migrant workers and refugees are often the most at risk from health impacts. Many live in overcrowded accommodation and physical distancing is not possible. Sanitation facilities are sometimes inadequate. Language and cultural barriers limit access to healthcare services. Many face challenges in accessing reliable health information. For many, the cost of medical care may be too high. Others fear that they may be arrested if they approach health authorities for testing and treatment. There are also other impacts of COVID-19. A perception survey undertaken by the Malaysian Red Crescent Society together with the International Federation of the Red Cross and Red Crescent Society and the World Health Organization revealed that migrant communities are often blamed for the spread of COVID-19. These perceptions could further push them into hiding and prevent them from seeking treatment. How then can we include these at-risk groups in our pandemic preparedness and response? This is not an exhaustive list. Of course, we have communities who are also very vulnerable, such as the homeless community, detainees, of which is a high percentage of infection, particularly in Malaysia. Firstly, we need to remove barriers that prevent some groups in our societies from accessing healthcare. Cost should not be a barrier to accessing testing and treatment. This principle needs to be true irrespective of a person's legal status. It must be a whole of society approach. Health information must be accessible in the languages of all, including migrant workers and refugees. We need a targeted outreach And one of the best ways to do this is to have community health volunteers from all groups in our communities, including those from the vulnerable communities. Second, we need to build trust with local population. This is not a moment for strict measures that may deter migrants and refugees from approaching authorities. Trust is a key element in social cohesion and a tolerant society. We need also to quickly address stigma and discrimination. This trust is, I believe, a key ingredient to preparedness, because often by the time of response, it is too late. That is why Malaysian Red Crescent Society, we're working closely with the public authorities, with IFRC, with WHO, and civil society organizations to enhance community engagement and accountability measures informed by evidence. Thirdly, we need to recognize that the only way to manage and overcome a pandemic is through an approach that engages and meets the needs of all members of society. In the words of Mahatma Gandhi, a true measure of any society can be found in how it treats its most vulnerable members. Thank you, Mr. Assi.
Thank you very much, Your Highness. Leadership is critical, as you said. It's about inclusion. It's about engaging all members of society. And Maha, you've been sitting in different leadership positions, and then you've seen it from different perspectives. What do you think? How can engage all members of society to build that trust that is required for preparedness and the response? You unmute, please.
It's really very intriguing, to just sit in a position where you need to be really acting so fast with evidence, with science. So it's the type of leadership that really matters, how to have the vision, the political responsibility in order to be able to see and to really address all of the needed actions in order to move forward successfully, having a new vision, having to restructure aspects and elements in order to be able to just grasp what needs to be done on a reactive manner, unfortunately, for this pandemic, but in a more resilient way to think into the future. So we have the basis of the coverage, and so we have the basis of the human rights perspective and the issues of the universal health coverage, how to bring in all of those aspects into a framework of action that really supports the security, the preparedness, and the inclusion of all of the vulnerable groups and all of members of the society in an equitable way and in a more equity, and as well what needs to be done and in a more resilient way for the interest of the people, for the interest of the government, for the interest of the economy. And I think this really warrants much into thinking of the type of leadership, the type of the political responsibility, and the type of the social responsibility that have to come into cohesive way into a framework of action that supports the needed outcomes. Thank you.
Thank you very much. Amanda, we heard that the pandemics do not discriminate, but we're not all equal, in front of them. Some of us, are more vulnerable than others. Hence, the necessity for inclusion and to get away from stigma, discrimination, and all the like. And that will not happen, without leadership. What does it take, for leaders to address that?
Yeah, I think epidemics don't discriminate, but they definitely exacerbate any inequities that we have. And just like natural disasters, epidemics almost seek out the poor and exacerbate the inequities that we have in access to healthcare, but also the resilience that communities and families have to respond to the shock. And I think what we've seen is a real balance in countries responding to that inequity by putting in public health and social measures during COVID. We've seen some countries respond to balance out the negative impacts of those measures. We've seen mitigation measures of unemployment payments and small grants to communities and households And some countries haven't done that. And that's where we've really seen the inequity exacerbated, and we're really seeing big differences, not just in transmission, but obviously in case fatality rates as well. And so I think it really takes leaders to be looking at the data, looking at how not just the disease, but the control measures are impacting different parts of our communities, and trying to mitigate those negative impacts to make sure that there is balance and equity in both how the disease transmits and our response to it.
Indeed. But we also mentioned that cost should not be a barrier to that, because what is at stake is well beyond the short-term investment. Patrick, what do you say to that from the bank?
Thank you very much, Asi, for this good discussion. So the Asian Development Bank, we are a 49 country membership that range from 1.3 billion people in a country like India to less than 10,000 people in the Pacific. Some of them very decentralized. Indonesia, 17,000 islands. Philippines, 7,000 islands. A very, very complicated region. And we have looked at this issue of leadership and done case studies across many of our countries to understand what makes some countries more successful than others. And so in such countries, the countries that have been successful, there's been very open communication between the leaders and the population, and leaders at all levels, not necessarily just at the head of state. The leaders across sectors, the leaders at the provincial level, the leaders at district level. There are places whereby some provinces are much better than the whole country, for example. And so looking at leadership and having an open communication and a trusting communication with the people, whereby the leaders admit what they know and what they don't know, and saying that we are all in this together. It's like war. You declare war and you bring in your best to try and fight the war. And then on the issue of financing, making sure that this does not become a financial barrier. If someone is sick, they can seek care without paying for that particular care, because this is a crisis that sometimes you're infected because of your line of duty. You're a primary carer, or you are someone providing essential services, and you get infected. And you get infected because you're trying to help society. So you should not incur significant financial costs. So to the extent that the country can provide resources to ensure that people who are infected during a pandemic do not incur a significant financial burden is extremely central, because then at least people know that the state is with us, the society is with us. We are not on our own. And also looking at some of the countries I've looked at, the countries that have done very well are countries that have had epidemics or pandemics before, like the SARS pandemic in 2003, or H1N1 in 2009, or the MERS epidemic in Korea. Such countries have been able to use the past experience to prepare and to ensure that if it comes to a matter of testing, where would people go for testing? What is the role of the private sector? What's the role of the community-based organization? What is the role of the military? What's the role of the disaster units and so on? So through a very collective, all government and all society engaged is the way that we can have leadership to address a pandemic. Over to you.
Thank you very much. I think you're all putting us, on a very good start. And Your Highness, I'll come back to you now for, just giving us some piece of advice on two things. One, what does it take, for leaders to really be accountable, and how those leaders can build trust that is required for preparedness?
Thank you. I think in order for leaders to create trust is to behave in a trustworthy manner, and that reliable information is competently delivered, and communication is honest and evidence-based, and that, like Mr. Osewe said, that when it comes to uncertain situations, our leaders should admit to being relatively uncertain to a topic rather than to paper over certain decisions, then have to backtrack. And I think that those are critical. Messaging is absolutely critical to engender trust of the community at large. and also the trust that the governments must fulfill when they promise to give financial assistance to low-income groups, to small businesses, that financial assistance is delivered on time. So aid should be delivered according to promises made by the leaders. Thank you.
Thank you very much. Invest and invest on time and in time is a motto that we always hear. Invest now so that we don't have to pay more tomorrow. Let's do what is required today so that we have the future we want tomorrow. And that is about preparedness. That is about also putting the resources that are required at times where they're needed most, and not when in the middle of a crisis, where when the crisis get out of hand. So Patrick, I would like to now invite you to reflect on how the international system, including the international financial institutions, can better coordinate to reform, so that we have the mechanisms that are required, to do the right investments on the right time so that we have the right results. Over to you, Patrick.
Thank you again. If you look at the history of the international agreement and establishment of international organizations, starting from the First and the Second World War, after every major crisis, an institution has been established. The UN was established after the Second World War. When we had the HIV/AIDS crisis, the Global Fund and UNAIDS were established. And I think that as this pandemic has just highlighted, that we need to have a system in place at the global level to make countries commit, or to ensure that countries are truly prepared. I think that this is the largest pandemic in 100 years, and it just underscored the fact that we've been talking about preparedness for a long time, but we are actually not prepared. So there's something missing. There's a gap that we need to fulfill. The World Health Organization has an instrument in place, but perhaps there's something missing beyond that, because we've seen a situation whereby this has completely overwhelmed the global community, has overwhelmed regions, overwhelmed countries. So what is it that is missing? And if you can identify this so that we do not run into this situation again, whereby the global economy was basically brought at a standstill. Thank you.
Thank you very much. So you mentioned a number of times there is a gap and there is something missing. And we have to clearly identify what the missing link is from a different perspective. And let me now start with Amanda. From your experience now in health, as well as in disaster management, where health is always a very important component, and in epidemics, before even COVID-19, you have seen it at the global level, but I met you also at the most local level in communities where you can identify those gaps, what is missing. What would you see as the missing link there in the financing for better preparedness?
I think it's that we're packaging it as preparedness, something that we don't need until crisis. Actually, the investments we need to make are in strong public health systems and strong, resilient communities that are responding every day to health threats. These are not, COVID-19 is not the first epidemic or the only epidemic happening at the moment. Many countries, especially in Africa, are dealing with multiple crises. Nigeria has monkeypox, cholera, yellow fever, Lassa fever, and COVID right now. And so I think the missing link is thinking that this is something that we need for a rainy day. And it's not. It's something that we need every day, strong public health systems that need constant investment to improve public health across the board. So I think that's one piece. The second is thinking that we need more. I think part of what we've seen on the ground is that you can achieve a lot sometimes for not a lot of money. Building trust with communities is critical, and it's not necessarily expensive. And better use of the money that we have. So one of the challenges that we have working with the Resolve to Save Lives team and our relationship with the Asia Development Bank and the World Bank is helping countries spend the money that they do have from multilateral partners more strategically. And investing in those longer term capacities, including people, instead of building bigger infrastructure, but really investing in people and systems. And so I think we can do more with what we have. More would be better, but we can do more with what we have, with more constant and continual investment for every day, not just these very large events that we're faced with right now.
Thank you, Amanda. We could need more, we could do more, we could do more with what we have. And we could also, help, make the money work that already exists. Maha, you've seen that in your position, in government, as a minister, and what would you see now, taking a step back, in your position that will make it really work in terms of investment and financing?
Well, there's always the trade-offs that you need to make between, and it's difficult balance between protecting people, investing in public health, investing in the primary healthcare and the systems, and at the same time investing or moving forward with the economy and the economic part, which really affects many of the decisions in many countries, particularly the lower and middle income countries. So this is the trade-offs and how you can make the case for the investments of the public health and investment in the primary healthcare and the healthcare systems, given the fact that many of the policies and many of the actions taken outside the health system really directly affects what is happening in the health as well. So in a way, financing is a major factor. However, as mentioned with my colleagues, efficiency in the utilization of the resources and the scarce resources, prioritization, and investing in a more sustainable preparedness and more resilient health system is really very important. And it is an entry point for getting a more comprehensive framework of action that would support not only the COVID pandemic, but to look forward into the future, building on the experiences, and at the same time making use of the multilateral coordination, which is really needed with multilateral systems, and how to use the resources efficiently, prioritizing, making the right trade-offs, putting health as a priority in all the developmental issues, preparedness and emergency response, and public health investments are really the core of any changes or any restructures needed for the future resilience of the response.
Thank you very much, Ma. It comes clearly out that health should be an investment, should be regarded as a true investment that is bringing dividends, and not, as an expense, kind of a social expense, somewhere, that we have to deal with. And that investment should happen, of course, at all levels, like you all, rightly say. Your Highness, I often say that the pandemics, they start in communities and they end in communities. And at the community level, also, we identify gaps that needs to be fulfilled, with investment and financing. And Red Cross and Red Crescent, movement is right there at the community level with millions, of volunteers on the ground, including the thousands of Malaysian Red Crescent Society volunteers. From your perspective, where do you see, the gaps and the need for investment, to be filled for better preparedness and response?
Thank you, Ms. Arsi. Yes, I agree that the very nature and DNA of the Red Cross and Red Crescent societies is about partnerships and collaboration. And I think this pandemic has emphasized that we need to forge better partnerships with corporates as well as government. Moving forward, I think particularly in looking at regions, we, the Southeast Asia region, also need to start working with our national society and engaging to address shortages in PPE, for example. Since we are a world-leading rubber glove producer, we can work together and prevent these shortages on a coordinated level. As you mentioned earlier, that we are leaders in forecast-based financing, which is early action, where we put pre-identified thresholds for climate-related hazards. So when triggers are made, then based on science and climate evidence, we can start providing disaster relief emergency funds to the country involved. And we also have in the Red Crescent, Red Cross movement, what we call impact-based forecasting, where upon a certain trigger of bad weather or a pandemic, that certain actions will be taken, and people will be relocated, livelihoods will be protected, and hopefully we will then start to move towards anticipation of crisis rather than merely a reaction from crisis. And I also like to bring up the point that now that we have entered into this era of a global pandemic, perhaps we should look at possible packages for medical insurance for pandemics to be taken up to protect workers, to protect people, should cover, that premium should cover perhaps a pandemic risk financing and insurance program should be pursued. So these are just some ideas that I'd like to suggest.
Thank you very much. Patrick, you've heard from the colleagues that, well, countries and communities, they face multiple deprivations. Now, we're in the middle of a COVID pandemic, but there's not only COVID. We're dealing also with other concurrent, diseases. And, Maha mentioned, trade-offs that needs to be made. Positioning health as a development issue, that, again, is worth investing for its own right, but for the sake of other sectors, as well. Let me ask you then back again, how can you see that investment from a multi-sectoral point of view, from a transversal point of view, and how do you engage, leadership at all levels, as it has been mentioned before? Patrick.
If you look at the past, for those of us who've worked on many pandemics, there was always, you see, there's an investment case made to finance HIV/AIDS, an investment case to finance TB, investment case to finance various other pandemics, and so on. I think that what has happened with COVID is that the investment case has been made for us. In the past, it was very difficult to get the attention of ministers of finance. And when we tried to organize a meeting of the ministers of health and ministers of finance in September this year, it was amazing how ministers of finance were so interested. The ministers were invited, and in certain situations where the deputy was not invited, they were asking, why are you not inviting me? Because the case, it's very clear to the finance ministries, given the economic impact that COVID has had on various economies, that health is a very, very important issue that requires significant investment. So I think that from the perspective of countries, and particularly on the health sector, this is an opportunity that we should not waste. This is a crisis that we should not waste, to ensure that health is incorporated within the development framework of a country, similar to how countries deal with disaster. And I'll get into the details when I'll be talking about sustainable, responsive, and reliable financing. Over to you.
Thank you very much, Patrick. Building on your statement, and very good point. We can say that what started as a health issue becomes a multi-sectoral issue. It becomes a development issue. It becomes a social issue, it becomes an economic issue. So multi-sectoral issue will call for a multi-sectoral response. And a multi-sectoral response will not work if it is not coordinated. Not coordinated in a manner that is bureaucratic, but coordinated in a manner that is agile, that is flexible, and that enables action. And that is also guided by evidence, bringing R&D in, being guided, by science, looking at measurement. All those elements, should be coming into place. Let me now invite you, then Maha, to give us, an introduction, on how and which type of reforms, should happen at the international and maybe also at the national level, because that's where it happens most, to facilitate, that coordination that will include procurement and supply management systems, that will include, distribution, allocations of resources, prioritization, and the like. Over to you, Maha.
I'm sorry, I haven't heard, I didn't hear you well, so I'm sorry.
The question is, now we are getting into the third axis, which is about the coordination and the understanding of the multi-sectoral nature of health and what kind of a flexible, agile coordination mechanisms do we need at a national and a global level. And I'm inviting you to introduce that segment.
Okay, so thank you very much. Yes, so before introducing this, the agility and the coordination, I would like to pose questions differently. So, like, what have we learned from the response as per the health systems or the different systems response in the past month on the global and the regional levels? And if we step backwards to assess where we are at this point, how we want to move forward, where are the gaps, and how can we strengthen the needed actions? So we need to ask ourselves, did we do well, or are we doing well? And what and how and where do we need to do more? More needs to be done on the global, regional, and the national levels. So we know what does success look like. We know what is needed and how does it look. And we know by now that successful pandemic, we need solid public health requirements. We need it to be in place. We need to have a strong and effective actions. We need to have rapid response. We need to have coordination. And at the same time, we know things that work well, the testing, the all of those measures, public health measures that have to be done together with the social or the whole of government approach and the whole of social approach as well. So it's a measure of success that needs to be done all together and to be done in the right way, depending on the context, depending on the resources, depending on the vision and what needs and what outcomes are needed. So we know that the measures are there, but we also know that these are not enough. We need more investment, as we said. We know agile systems that invest in public health and invest in health workforce, invest in the protection of the health workforce, and at the same time will secure the provision of the procurement. We need the evidence, we need the research, R&D. All of those elements are not particularly sensitive to the capacity and the readiness capability of the different countries. So we need this multi-sectoral and intersectoral approaches that would support the continuous flow of the procurements and supplies. We need the continuous flow and the continuous upgrading and promotion of the R&D at the same time in order to support the new innovations and the new vaccines. And at the same time, we all know that the health sector response, as I mentioned before, are affected by policies and actions taken outside the health sector. So we need a coordinated government approach, utilizing all the resources in order to guarantee the consolidated results. So we know that we have multiple successful responses based on the coordination mechanisms at the different levels, ability to share and to generate information. And this all requires resources, and it all requires proper capacities, proper preparedness, and the commitment of the leadership and decision makers in order to provide and to invest and to support all of those aspects. So while, like the World Bank, they usually say that the trade-offs are challenged by the complex interactions and between the epidemiological, demographics, the fiscal space, and governmental capacity, and all of this we need to support for the service delivery systems. And here we come to the solidarity, which is really essential when we're talking about the different aspects. We know that gaps still exist, and the colleagues mentioned many of the gaps in the preparedness gaps. We have gaps in the emergency preparedness, in the integration, coordination, and at the same time, the R&D. We know, and this has come up very clearly in the GPMB report, the R&D, and how this has been managed successfully with the WHO on the global level to support not only the research, but as well the COVAX facility and the tools accelerator. So I mean, these are issues that we need to be supporting, and at the same time, we need to understand that we need to build the agile systems. We need to build on the leadership and the governance issue. And now we have governments to be moving on the different levels in order to support the coordination, to support the intersectorality and multisectorality, and at the same time to support the macro stability. We need economic economic stability in order to support all the actions needed. And this requires the health investment. So health comes as a priority in the development, with building of the case for the health security emergency preparedness, and at the same time strengthening the national system's response in order to contain this pandemic and the future emergencies as they arise. So thank you very much.
Thank you very much. All excellent points. You know, the central role of government is very critical, and you mentioned that. And that also ties very well with our interaction on the importance of leadership. But we also have learned that a true national response is more than a government response. We also have learned that a true global response is more than a UN response. There are many actors, at the national level and at the global level that need to be brought into the agile coordination mechanisms, to play their role. Amanda, how do you see that, at those different actors that need to be on board, to have the true global response or the true national response?
I think it means that we have to be consistent in that. We can't expect that agile coordination just to happen in a crisis. It means we have to invest in those relationships before these types of events. And we have to make the case that this is as important for those other sectors, for the airline industry, for the tourism industry, for private sector, as it is for healthcare. And so we had a number of events, I think, leading up to COVID-19, which were interesting into, the World Economic Forum and the World Bank led a number of CIMEXs where we were engaging with private sector. We were starting to build those relationships, but it needs constant investment. And I think we need to do a better job at a local level and a national level of including those other sectors when we run CIMEXs, when we do after action reviews of our epidemics, and not just think that we can pull that type of level and coordination and collaboration together once the disaster has happened. So really investing in those relationships early and consistently, I think, is key.
Thank you very much. And in investing in those relationships in a consistent manner, one will be addressing also innovation, along the way. And you mentioned some of them: digital health, other type of innovation. And innovation, sometimes when we talk about it, one thinks of gadgets, or some kind of tools, that you use. But it may be much more than that. Innovation in coordination, innovation in financing, innovation in approaching, an epidemic and a crisis. Patrick, how would you see innovation be integrated, in that, to have the right coordination mechanisms, along the way?
Thank you. Let me use the issue of COVID vaccine to try and answer that question. We always talk about preparedness, and I think that in terms of vaccines, there's some good successes that I see. Even before the vaccine was discovered, 4 months before that, starting from around August, there's been a lot of discussion by development banks regarding how can we support countries to obtain vaccine, and how can we support the countries once the vaccine arrives at the international airport to distribute and deploy the vaccine up to the lowest level. And there's been a lot of discussions, a lot of in-house, for example, if I take my own institution, the Asian Development Bank, we've discussed at length, and on Friday will be our board is meeting to approve a package of $9 billion to support countries to obtain vaccines. The World Bank did going through a similar process that approved $12 billion. The Asian Infrastructure Investment Bank, we've had a conversation, and they are ready to co-finance with us. They have up to $3 billion. And we talked to the Islamic Development Bank this morning, and they're also in discussions how they can support countries to obtain vaccines. So the vaccine, only one has been approved so far by one country, and will be approved by the US authority perhaps over the next several days. But there's significant resources for countries to obtain vaccine. At the global level, there's also an entity that has been established to support low-income countries and middle-income countries to obtain vaccine. So on this particular score, there has been very good preparedness in terms of ensuring that their financing is there and that there's some equity in terms of the way countries are going to achieve vaccines. Second, on the issue of innovation, the biggest challenge is how are we going to distribute this vaccine? If you take, for example, most of the vaccines require 2 doses. So, and it's a vaccine for adults. So how are we going to ensure that the person who gets the first dose gets the second dose? How are you going to ensure that there's distribution up to the lowest level, up to the lowest health center, and that the dose that you get today is a good dose that you get 3 weeks later when you're ready for the second dose and so on? Significant innovation in terms of implementation. How do people think outside the box to be able to remind people who have had vaccines to come back to the clinic for the second vaccine? So many innovations going on. Look at the cold chain. How do you do something for adults for something that traditionally was done for children? So innovation in terms of logistics and supply management. So much innovation that's going on that in engaging both the technology aspect and the non-technology aspect, implementation aspect. And I think that the lessons from how we are approaching this vaccine perhaps could become one of those global best practices. So how do you mobilize across financial institutions, across countries, across sectors with the Ministry of Finance to ensure that you deliver something in a good, very quickly to the bulk of the population? Over to you.
Thank you very much. So what we also hear very loudly here, that it is a consistency, perseverance, are all extremely important to achieve that sustainability, meaning to be there before a crisis, be there during a crisis, and then continue to be there after the crisis. Your Highness, the Red Crescent volunteers, one of those were always there before, always there during, always there after, alongside communities to accompany them to respond to their needs. So they are critical actors also to be part of the agile coordination mechanisms. How do you see that, from that angle, and how they can be, involved in those structures to make a national response more than a just government response?
Thank you for the question. From my point of view, I think we are, as members of the Red Crescent and Red Cross family, we have very much worked on sort of focused on working on our own in Malaysia. But now I think what is important is to realize that our volunteers must collaborate with other civil society organizations in order to be more effective, in order to be more agile, and in order to deliver more impactful humanitarian responses. So we've decided in Malaysia to form a Malaysian Humanitarian Coordination and Action Hub. This is our innovation, where it's a coordination platform attempting to connect donors, civil society, government agencies, and to enhance coordination in our humanitarian preparedness, response, and recovery. It has had buy-in with the public authorities, and we're currently discussing the methods of how we are going to work with the government. We want to provide what is important now is a data-driven platform for all humanitarian work. What type of support we deliver, where we deliver to, down to the postcode, the town, or the village, and the value of what we deliver. So I think this is the future of our test of our agility, is how we respond to this crisis, particularly in terms of our vaccine distribution, our messaging of how to be developed or how to approach vaccination process, who is to be vaccinated. So I think we are, as auxiliary to the government, have to work on this sort of approach collectively. Thank you.
Thank you very much. We have heard after your introduction, the different dimensions, the different sectors that needs to be involved, the different issues, all the way from innovation, down to, expanding the base for other actors, to get involved in. And again, reminding us the role of leadership and the role of government, to be in the driver's seat. at a national level, where do you think should a best, nimble, agile coordination mechanism be situated at a national level to ensure, that these gaps are being filled and we all drive, towards the same direction, capitalizing on each other's forces?
Well, again, really, and I think all the points mentioned are really very important for building the agile systems, and this is the opportunity to rethink policies and to rethink things that are happening on the ground to build back stronger systems. This is the opportunity now for the peoples, for the economies, for the health, and for the preparedness. And for this, on the national level, I'm talking now, for this response to be responsive, to be adaptive, to be flexible, we need a strong governance mechanism. Governance mechanisms whereby there is commitment for the government to act and react according to collective actions and to restructured pattern of doing work, utilizing the tools that are available in order to do more, to fill the gaps, and to build stronger, resilient communities and health systems. If we're talking the innovation part, yes, it's not only innovation of how to bring in the vaccines, let's say, it's how to distribute, how to go to the subnational level, to the very peripheral points, and how to make the communities responsive to this, and how to make the health workforce responsible. So this is a collective action that needs to be revisited based on the actual needs, based on the experiences, based on the context, within a governance arrangements, a leadership and governance that guarantees the commitment in order to support this. And it has to be at an independent, higher level, positioned to steer all the actions, because it's not only governmental actions. We need the private sector, we need the non-governmental sector, we need the community, as we mentioned, a whole of government, a whole of society approaches built on the governance structures, the stewardship and the leadership for a comprehensive, resilient response that incorporates all the stakeholders, have all the stakeholders together to repackage the needed actions, and not to reposition, but to have a newer oversight of things that needs to be done, given the whole resources that are available and the tools that could be adapted to the situation and to get the proper results. Over to you.
Thank you very much. Thank you all, colleagues. You all seen that this pandemic is really forcing us to be humble. It is forcing us humility, it's forcing us to question our certainties on many issues. To question certainties, not to despair, but to open ourselves to learn and to improve on what we have. But it also questions, the certainties on, some of the hypotheses, we had. Well, we talk about preparedness, but we realize maybe our definition of preparedness, is inadequate, because some countries that we have thought should have been the best prepared ones fared worst, in responding, to the epidemic. And then why is that? So I've been able always, to measure, what we are saying, to measure the progress that we are making, and then to use those measurements, to define and conceptualize, the concept, like the preparedness, we're talking about. Amanda, can I invite you, to reflect, with us on that, by looking at how should we be measuring? How can we test national and international preparedness? How do we know that we passed the test, nationally and at the international level? Over to you.
Thanks so much, Asi. I think for me, the question is, why are we measuring and what are we measuring? And I think your point about being humble is extremely important here. I think there's been a number of indexes using the joint external evaluation and then the next iteration of that with the Global Health Security Index that added several other components, but still very much reliant on risk and capacity to respond in the health sector. And I think if we, pandemics are not new. We've been doing this for centuries. There's been several very large pandemics, and they've been controlled with community engagement, behavior change, and strong decision making, not necessarily just medical countermeasures and health systems. And so I think part of the challenge in measuring our progress and whether we're ready to pass the test is looking beyond the health system and being humble about where success comes from. And it comes from clear evidence-based decision-making at policy level, making those clear choices. And I think we gave ourselves some false dichotomies at the beginning. We were choosing between health and economics, and it was a false dichotomy. They come together. How do we support health and protect the economy, save lives and livelihoods? How do we prioritize simple things like hand washing and wearing masks over vaccine development? Those are the things we've seen several countries control the outbreak without a vaccine by engaging their community, by clearly communicating what needs to be done. We've seen several countries essentially have zero transmission for, I think I read yesterday, Fiji's at 200 days, for example. The small island states, including New Zealand, are a bit of an outlier, but we've seen countries like Australia come down from close to 1,000 cases a day to completely control the outbreak as well. So these simple measures, these humble measures that sometimes I think we overlook, do work in these circumstances. And I think we need to do better to make sure that we capture not just the strength of the health system, but the political system and the community social cohesion. And I think it comes back to that critical piece of trust. You can surge everything. You can surge health support. You can change policy. You cannot surge trust. It has to be built over time. And so any index in terms of measurement, I think, has to capture the political, the health, and the social aspects of what's required for a multi-sectorial, all of society response. And then I think to answer your question finally about how do we know if we'll pass the test, the best way is not an index. You can measure yourself. It helps accountability. It helps generate political will. But the best way to know if you'll pass the test is how you performed in the last test. And this idea of critically analyzing how we're responding to constant public health threats and using that to improve the system, the importance of the after action reviews or the CIMEXs, I think, is a critical piece to add to those indexes. So use the indexes, use them for accountability. But I think we need to add that capacity and capability component. So how did you perform in the last test? Use that as part of the score to balance out just the checkbox approach that perhaps we've had in the past.
Thank you very much, Amanda. Very wise counsel. How did you pass the last test, and then use that as a baseline to see what we're doing.
May come on that?
Yes, absolutely. I was thinking of you. Are we passing the test?
Yes, I think that Amanda has laid it out very well. So I've been reflecting on this question because if you look at the joint external evaluation that were done across the world, the best prepared country was the United States. But then when you look at how they've performed in the current epidemic, they've not done very well. And the countries that were in the mid-50s, like Thailand, Vietnam, Cambodia, have done much, much better in the current pandemic. In fact, of the case studies that we've done, when we look at countries like Vietnam, right from the beginning, from the first case, they were very aggressive in terms of ensuring that they were ready and that they were prepared not to have many more cases. The same applied to Thailand, that were mobilizing the community health workers, the village health volunteers that were able to mobilize the community and reach out from household to household to educate the people, to ensure that the quarantine worked. And so it raises the question regarding some of the tools that we have. Maybe this is a good opportunity to also, as a global community, look at do the tools that we have actually measure the right thing? Why did we miss it so bad that countries that scored so well during those assessments turned out not to perform very well during the current epidemic? Is there something that we missed when we are doing those assessments, or is it something that was missing from the tool? Over to you.
Maybe Essie, I would like to respond to Patrick, because I think the tools and the indexes measured our capacity to respond, not how well we would use that capacity. And so we've actually just finished analysis of the JEE against caseloads and testing capacity. And the JEE was a relatively good indicator of countries' capacity. What was missing is the difference between being prepared for an epidemic and responding and acting to the threat. And I think we've seen your example of Vietnam is a great example. Senegal is another great example where they had improved preparedness, but maybe weren't at the top of the scores of the indexes, but they acted quickly because they were humble. And we've seen countries that were most frightened of huge impacts act quickly and decisively and being able to control that initial wave. And so I think we have to be careful about criticizing the initial indexes and being clear on what they were measuring. They're measuring our ability to have a system that could respond. It doesn't measure our ability to activate that response. And the countries that performed badly and continue to perform very badly are those countries that aren't acting and using their capacity to prepare. And so I think this idea of how well you pass the test is how well you pass the last test is critical. There's how you prepared and how you act, and it's the combination of those two that will give you the result. You can't just be prepared and then sit on the sidelines and expect not to get hit the way that several countries have.
Thank you. I think you're both indicating that we are in a continuum here of preparedness and early alert and early response and then sustaining it. And then we will need to, along the way, define what are the tools, that measure each of those milestones and then steps, leading, forward. And then at the end, maybe having a kind of a composite index, that would be, showing us, this continuum. So, Maha, from your point of view, so what's missing?
Well, what is missing is the performance assessment. It's not only of if we have the systems or how the systems are performing. So we need to assess the performance in terms of the readiness, of the preparedness, and of the response within the health systems and outside the health systems, and to complement the preparedness, like, for example, indicators for the essential health services that have been disrupted, like for the immunization that has been discontinued in countries with more emphasis or with more lying burden on diseases that are already there. So we reached a point where it was a COVID or a non-COVID situation. And the issue here is that it is a COVID and a more than COVID comprehensive situation that needs a newer oversight. So it's the performance of the system for the pandemic, for the outbreak, and as well for other aspects that are needed for example, the essential health services, continuity of immunization, the maternal health services, the equity and the equitable part of the service provision, and reaching out for the vulnerable groups. So we need to capture this. And at the same time, we know that it's not only about the readiness and the preparedness and the response, but there are other aspects in the systems that really affects, like, for example, the governance and the oversight. We never measured, we didn't have, maybe there wasn't much time for the measurement of the governance part, for the community readiness and the community efforts that have been done in order to mobilize the communities. The governance, the adaptation, and the leadership part, they need as well to be measured and to be assessed, because they are leading aspects for proper response, not only on the national, but on the subnational level, depending on the context. So I mean, the context was not properly measured, like what is happening in Africa now and in some countries with the prior experience of the epidemics like the Ebola, and how the community work has overcome and has been undertaken to overcome all the community response with successes. So I mean, there are aspects that need to be introduced and incorporated into the assessment framework in order to give a better view of the situation and to identify needs for improvement and for collective improvement in order to see for the foreseeable future and how we can move ahead. Thank you. And just a second. No, yes. I just wanted to mention one thing. Measuring the performance or measuring indicators depends on the capacities of the systems themselves in order to generate the data, in order to collect the data. So I cannot have a proper assessment without having the capacity to perform the assessment. So it needs investment as well to have this system in place that is able to grasp or to collect data, to interpret the data, and to, in a way, provide it in a meaningful way that would affect policies and decision making. Thank you very
No,
much.
thank you very much, and thank you for mentioning data. I was going to challenge Patrick here on data, data collection, data analysis, and who owns the data, whose data it is, anyway, and then what we'll do with the data. So I've read somewhere some time ago that the World Bank is also the data bank. It is also a knowledge bank. It is also a bank, for sharing experience and for triggering innovation. So what's your view on data and data management, Patrick?
So when the pandemic started, and I wanted to find out what happened 100 years ago with the swine flu, with the Spanish flu, the pandemic. It was very difficult. I went through the various journals. I couldn't find what really happened. I had to go to the archives of. I went to the U.S. Library of Congress, that is the repository of many things. I couldn't find much. So I went to the archives of MIT to look at the newspapers that were published in 1918 to be able to understand what actually happened with the physical distancing, what happened with quarantine at that time, given that in that particular pandemic, which happened when the First World War was ending, and people were actually very close to each other in the trenches of Europe, trying to fight and across the world. And so now fast tracking and looking back at H1N1 and the various other pandemics, there's been a lot of publication in the archives of many journals. And so I think that when it comes to think about the development banks and organizations like WHO and some of the regional organizations, I think ensuring that we analyze the information is stored, there is a history so that when the next pandemic hits, people can actually look back and say, this is how the countries responded, this is how communities responded. And then from there, we can build on those experiences instead of letting everything pass. And then the group in the next generation, they have to start afresh the way we started, almost afresh, trying to learn from what happened in 1918. So I think that being a knowledge bank or a knowledge organization is something that should be a top priority, and we are as ADB supporting a lot of documentation, many case studies across our region to ensure that we keep the history of what happened during this pandemic.
Thank you very much. Amanda, I'll come back to you very quickly on data and management. But a number of times we have mentioned that when we have the health system, there is a community system. When we need to strengthen the health system, we need to strengthen the community system, as well. And we need also a certain level of social cohesion, as part of, that process. So before coming back to you on data, Amanda, let me ask Your Highness, how do you see then, data and then the importance of community systems, including even community surveillance, system in that regard, to make a contribution, to the preparedness at the national level?
Thank you, Mr. Asi. I think in terms of data and data collection, I think this is, and analytics, I think this will be the way of the future. And we need to be perfectly aligned. I mean, as in Malaysia, I think the use of technology and data is still fairly new, and I think we have a steep learning curve on this. But I think the true measure of success is from humanitarian point of view is to be at the right place at the right time. And I think it is also important to shift our responses and response models to a very localized and very integrated and localized to the community of vulnerable groups, as I said earlier. And secondly is to take the right actions and to support communities and local actors and take early actions, response and recovery efforts in a neutral and impartial manner. We should not be politicizing issues of public health, as we've seen in the media with the face masks and other arguments have just, I think, held back the success in sort of overcoming this pandemic. We also have to have the right capacity, and we as Malaysia Red Crescent have to develop our skills and building our capabilities to better understand and respond to increasingly complex humanitarian environment that the pandemic has thrown to us. We have, in the process of building the International Humanitarian Field School in Malaysia, where we hope to provide a platform for field studies and exercises on disaster management for the Federation and for member societies and other civil society organizations so that they can come and test and build and learn from the skills that we need to combat future health crises. And lastly, I think we have to be here at the right time and have the agility to harness science and data and innovate to anticipate future pandemics and provide proactive and early action. Thank you.
Thank you very much. I think it's a very nice note, to act now to prevent further pandemics and, to see how we pass the last test in order to prepare for this one, like Amanda said. Amanda, let me give you then the floor to wrap us up on this segment and give us your reflection, final words on data and measurement.
Yeah, I think that old adage, what measures gets done, is really very true for preparedness and epidemics. And so measuring our capacity and constantly testing it is critical. But understanding the data collection and all the way through to the decision science of that, I think one of the challenges we're seeing now is almost too much information, too much data, not contextualized. And how do we support country decision makers to disaggregate the data, to identify those inequities that we started the conversation with? How do you understand who and how the epidemic is impacting individuals and communities, and really using the data to drive response option planning to better understand who and how communities are being impacted? So I think, as you said, community-based surveillance, I think, is a real missed opportunity. That early detection is so critical. We need to value the community level data all the way up to the R&D data. But the trick and I think the real synergy is, how do you bring those data streams together to give you the whole picture of what's happening in the outbreak, and really make sure that we present that in a way that decision makers have the evidence that they need to address all aspects of the epidemic, and not just focus on one, the health piece or the economic piece, but really put it into context. And it's a challenge. I think we have a lot of work to do to improve our use of data to inform not just epidemic response, but our overall response to health.
Thank you very much, Amanda. So participants, our wonderful panelists have taken us, through the different dimension of preparedness, taking us from the human dimension to reforming the financing and, the agile systems and stronger coordination mechanisms that are required, and also the measurements, as well as data like we just have heard. I would like to ask now my panel members, each of you, maybe to share with us one word of wisdom, which is one action point that you think is critically important in strengthening national and global preparedness. So while I have you still on the beautiful screen, Amanda.
1 point. I think this is an opportunity of a generation to improve governance and systems at community, national and global level. And if we need to take that opportunity now to learn the lessons and to make sure that we're not in this position again.
Thank you very much. Patrick.
I think there are many lessons that we can learn from our disaster colleagues. Every time that the disaster strikes, we find poor countries like Indonesia, Philippines, they're always ready. It's always clear who's taking charge. It's always clear who is leading. The role of the community, the role of the Red Cross, the role of the government, the role of various sectors is always known. And even before any external help comes, the country always know what to do. In fact, they know in advance. They're telling people to go to higher ground. The tornado is coming, for example. So I think that in the health sector, we should try and learn from what's happening in the country with the disaster management teams to be able to support future pandemics. Thank you.
Thank you very much. Your Highness, one action point.
Thank you. As the Red Cross and Red Crescent movement is the largest voluntary organization in the world, I think the challenge or the point I'd like to make is to improve the quality of volunteers and volunteerism, because we've seen that in a report, volunteerism has increased manyfold since COVID-19. People are empowered, people feel generous, there's an unprecedented humanity and kindness. And this is what we need to capitalize on. So the challenge for the national societies is to improve the training of our volunteers, to provide adequate duty of care and to improve the duty of care to our volunteers in terms of insurance and protection, and then to provide them the tools to conduct humanitarian work, which is essential as best as possible. So I think we really need to make the most and train our volunteers to make them most effective in any given crisis, whether it's a pandemic, a health crisis, or we don't want to say, but a furthering of a climate crisis in the years to come. As we can see from the IFRC World Disasters Report 2020, the future will remain very complex and very, very challenging. Thank you.
Thank you very much. Maha, last word of wisdom.
Yeah, well, thank you. So for me, and I think for many of the colleagues, it's leadership and commitment to health and security. And it's the governance and the transparency part which leads the needed actions to build better for the agile systems as we're moving ahead. And at the end, it's not only the government's only responsibility, it's the government's and the community's shared responsibility that we have to build upon, looking into the future, coming 3 months, 6 months, 1 year, and making use of all the innovations and the innovative actions that could support this response. So we need innovations and we need to be using these tools as well. So over to you.
Thank you very much, colleagues, for communicating so strongly a resolve and a commitment and a determination that are all required to prepare and respond. But we have to be determined, as we said, while being humble at the same time. We have to be humble, without being weak. We have to be humble without being complacent. We have to be humble, not to despair, but to open ourselves, for new learning. To engage in a path that is a path of questioning, the questioning to improve along the way on each step, that we are undertaking. We also are opening up, to see there is no dichotomy, preparedness and response. It is a continuum, all the way down to resilience and then building capacities of communities to withstand shocks. We see the importance of health for its own sake. Health as an emergency, but health as a component of every emergency response that we see. We see what starts as a health issue become a multidimensional issue, a multi-sectoral issue. Hence, the false dichotomy between health and the economy, but both bringing them together, putting people and people's well-being at the center of it. And to paraphrase in the Red Cross and Red Crescent word, the only one humanity we all share. And that sharing then extends to the sharing of leadership, to the sharing of responsibility, to the sharing of accountability to build a trust. Because there will be no trust without accountability. There will be no trust without respect. And it is extremely difficult to build and trust in the middle of a crisis. To be there before, to engage. To be there during, to accompany. To be there after, to build capacity and resilience. It is the same continuum, that we are calling for. And that's again, where leadership, where financing, where coordination mechanisms and where measurements, come all together, in the path of a resilient, health systems, that we would like to see. Well, we hope we have learned a lot, from the pandemic, and we continue to learn. Thank you, everybody, for sharing your insight, sharing lessons, but keep pointing all of you to each of us on a point, that we can all reflect on, that will move us, on the same path. This is taking us, at the end of our session. Thank you very much again, everybody. And thank you, my fellow panelists. And good afternoon, good morning, good evening. Bye-bye.
Thank you.
Thank you.
Thank you.
Thank you very much.
Thank you very much. Thank you.